Important that we have this time to weigh in on such an important topic. I think we all know that school-based medical access dollars, those federal dollars right now, are somewhat vulnerable as Congress looks to make changes to the Affordable Health Care Act. And so we felt it was important to educate Senator Casey and his team about that impact to us here. We know nationally that school districts receive about $4 billion annually in these dollars. If we peel that back a little closer to home, in Pennsylvania, our 2014-15 data indicated that our school districts in our Commonwealth received $134.7 million in that 1 year for medical access dollars for children. In Lebanon County that year, if we want to bring it right here to our home community, our 4 participating school districts in that same year received over $600,000 in federal school-based access dollars. So clearly, this is a very important topic to all of us, and we were very fortunate in being able to bring some families together today and some school personnel, all of whom will share a little bit about what this means to them and the impact of these dollars, what they have in their lives and in their work. So before we jump in, however, I do want to acknowledge the press who's here today. If you're here with the press, welcome. And
I'm kind of required.
Okay.
Let me just say in conclusion, maybe 3 things. Number 1 is thank you for doing this, for in some cases bringing your own family story here individually, and for others just for bringing the work you do as either public officials or folks who work in the field of education. Especially at a time when there's a lot of stress and a lot of difficulty. And we need you to keep staying engaged to the extent that you can. I know you don't have a lot of free time. You probably do more, the parents in the room, and others probably do more in the first hour of the day than I do in 6 hours or longer. So we're grateful for your time here. But we have to keep making this argument because sometimes in Washington, another topic or two can distract or push people away from the importance of this issue. I'm going to be working on this healthcare debate for the next 3 weeks, and in those 3 weeks I could be working on a whole range of other issues, but we're going to keep it focused on this so that people know what's at stake, and then we'll see what how the vote comes out. But I'm not assuming anything, and I'm not believing any of these articles that are saying, well, they're having trouble lining up the votes. Every time I read an article like that, I put it aside and say, keep going, keep making the arguments, because we have to get through this period, and I hope stop what I believe is a very bad bill. It's bad for Medicaid, it's bad for the middle class, it's bad for seniors, it's bad for kids, and it's made all the worse when you juxtapose what they want to cut over time, and then juxtapose next to it are the kind of tax cuts that are almost hard to comprehend. You may have seen that one chart where I've used the chart, maybe I should stop talking about it, but I can't because it's so insulting, where they put on one chart, or one bar graph I should say, the cuts just to Medicaid expansion over the next decade, just for Pennsylvania, right? So one state, 10 years, just Medicaid expansion cuts. About $35 billion with a B. That's a big number, right? That's enough to get my attention. But then right next to it, they listed the tax cuts, which amounted to $33 billion, just $2 billion less than the 35 in cuts. And the $33 billion amounted to the tax cuts that would go to 400 families in the country. 400, the top 400 families in the whole of the United States of America by income. Now, if you're one of those families, I'm sorry I'm insulting you, but I'm not going to support tax cuts for 400 of the wealthiest families in the country in order to allow, I should say, cuts to Medicaid of that kind. That doesn't make any sense at all. That's even an insult to the people getting the tax cuts, the wealthy people getting the tax cuts, because you know what? A lot of them don't want to cut Medicaid to give themselves millions and millions, in some cases tens of millions per family in tax cuts. most of them would say, I don't need that. I make $300 million a year, or $400 million, or $1 billion, or $3 billion. I don't need that. Let's make sure that we can keep Medicaid strong for the future. So you're helping us to make the case about how critically important this issue is. And the school-based services, I think, are just the beginning, or we're just beginning to make those arguments. So your family stories, your own individual stories, and the challenges that you face as a parent or as someone who's working in the IU and trying to make ends meet, all of these arguments, all of these stories are critically important. So we're grateful for the time, grateful for your advocacy, and be willing to stay in the debate with us. Sherry, thank you for leading us. By the way, I've been going to a lot of communities around the state on this issue, and we're always looking for a good MC, so you do that very well.
I can assist in this issue.
I know you're
I'd be
not a
happy.
professional master of ceremony, or mistress of ceremony, but we're
Thank
grateful.
you. I'm very passionate about this topic as well. I support the state MA committee in Pennsylvania. And so this is an issue close to my heart. So I appreciate your time. And I appreciate the families and everyone coming out on such short notice. I think it was very informative.
Yep, it was for me.
I know we'll follow up with some additional information. The families have all been very gracious in saying that they're happy to share their personal contact information with you. So correspondence could continue if it would be helpful in any way.
It would be.
Thank you.
Thanks very much, everyone. Great. Sherry, thank you.
Okay.